All right. Hello, and welcome everyone to ECD, the latest live. It is now my pleasure to turn the floor over to the Deputy Assistant Secretary for Early Childhood Development at the Office of Early Childhood Development, Katie Ham. Katie, the floor is yours.
Thank you so much. And thank you to everyone for joining. I know we have some folks that are still joining us. We're grateful for you all for taking the time today to chat with us. This is ECD Live. This is the third webinar in a series designed for people across the country to hear the latest information from the Biden-Harris administration on early childhood development. We want this to be accessible to parents, to childcare providers, to Head Start staff, to home visitors, to stakeholders at the national and state level. So we're grateful to you all for joining us. We want to use this time together to focus on the American Rescue Plan, providing information about resources and funding that's available and things that can help support you as you recover from the public health emergency and the economic impact. So that includes not only information on the American Rescue Plan, the funds available through childcare and Head Start and other benefit programs to families, but we also want to make sure that you have the technical assistance resources from the Administration on Children and Families, information on vaccines, public health guidance, and all of the supports that you need to stop the spread of COVID-19, continue operating early childhood programs safely, and reopen programs that have been closed. So the topics will vary from month to month, but we want to make sure that they are all focused on getting you the financial resources you need and the information you need so that we can build back better and move into reopening all programs that are closed and remaining open and serving children safely. Before we jump in, I want to touch on vaccines. Today, we are happy to report that 55.5 Americans have at least their first shot of the COVID-19 vaccine as we continue to do our outreach to get all Americans that first shot and that second shot if needed. You can go to vaccines.gov to learn more about accessing a vaccine near you. We hope that you'll be supportive in encouraging those around you who may have not gotten their vaccine yet to go ahead and get that. We know that it's the best tool we have to protect young children who are not able to be vaccinated, is to make sure the adults around them are vaccinated, their parents, their family members, their early childhood providers, the people in their community. So we ask that for the benefit of young children who are too young to be vaccinated, that you really support us and help us get the word out there. We know that many of you are partners in building vaccine confidence. As we see increases in COVID-19 cases due to the Delta variant, we hope that you can continue to help us spread the word. There are 3 ways that you can learn about vaccines in your area. The first is you go to vaccines.gov and you can put in your information and get more information on locations near you. You can also text your zip code to 438-829. Again, that's 438-829. Even though that number is 6 digits, it still will work as a text message. So text your zip code to that number. You can also call for information, and we'll put that information on the phone numbers you can use in the chat box. So if you need information on vaccines, use one of those 3 ways to get in touch. Second, I wanted to make sure that everyone saw the guidance from the Centers for Disease Control and Prevention that came out late last week. The CDC guidance addresses early childhood programs specifically and how these programs can mitigate the spread of COVID-19. This includes the latest information on best practices for things like masking, sanitation, social distancing. And for our school age and summer programs, we also have guidance on K-12 settings. So we're going to put links to that guidance in the chat. If you have any questions, please don't hesitate to reach out. We're also going to try to get those questions answered because we know, as many of you think about the fall, or you think about moving to a space where a lot of the adults in your program might be vaccinated, but the children are not, you're probably thinking about all of these issues and how you apply this guidance to your program. The next thing I want to mention is the child tax credit. Starting on Thursday through the American Rescue Plan, families can receive monthly benefits under an enhanced child tax credit. What this means is for each child under age 6, families will get $3,600. And for children ages 6 to 17, they'll get $3,000. These benefits can be received automatically through monthly payments through the end of the year, which makes sure families have resources in their pocket sooner rather than later. About 80% of families will get these payments automatically through direct deposit if they filed taxes last year. Where we really, really, really need your help is getting to those families that did not file taxes last year. Perhaps they didn't earn enough or weren't paid enough to owe taxes. They did not file taxes. And in that case, we really need your help in getting folks to go to the IRS website. There is a tool where you can put in your information if you did not file taxes and get signed up for that tax credit. This is a benefit that has a huge possibility to help reduce child poverty, increase economic stability for families. We know a lot of families are still hurting, still feeling the effects of the pandemic. We know that families in some cases are facing increased costs, and we want to make sure that they get the resources that they're entitled to. So any help that you can provide to us in that outreach would be much appreciated. Finally, I wanted to note that July is Disability Pride Month. It is also the 31st anniversary of the Americans with Disabilities Act. At ACF and the Office of Early Childhood Development, we're committed to making sure early childhood programs are fully inclusive for children with disabilities and making sure that programs are accessible to family members with disabilities. We will have a blog post up today expressing our commitment to making sure we're putting even more effort to making those early childhood spaces inclusive for children with disabilities. We hope that you will join us in celebrating children with disabilities this month and Americans of all ages with disabilities. So today we're going to hear from several speakers with updates on the American Rescue Plan, funding and supporting safe in-person services. I'm first going to turn it over to Dr. Ruth Friedman, who's going to give us an update on childcare and answer some questions we've been getting. Then we're going to turn it over to Dr. Bernadine Futrell, who will offer an update on Head Start. And we will hear from Martha's Table, a local Head Start program here in DC. And they were able to host the secretary a couple weeks ago. So they're going to share more about that experience. As we look forward, we know that the investments in the American Rescue Plan were just one step, just that first step to help us recover and help families recover from the pandemic. We are going to share more on the American Families Plan, which is the president's long-term vision for where we need to go for families in this country and what we need to do to support them. So later in the presentation, I will be joined by my colleague, Miriam Calderon from the Department of Education, and we'll tell you more about the American Families Plan and where we want to go next. But right now I'm going to turn it over to Dr. Ruth Friedman to talk more about the Office of Child Care and their plans in implementing the American Rescue Plan. Ruth?
Thanks, Katie. Good afternoon, everyone. Thanks for joining us. I hope everyone had a good 4th of July and was able to safely gather with friends or family. I'm going to just provide some updates for you from the Office of Child Care, starting with talking about where we are, where states are with stabilization grants. We now have 7 states that have posted their applications for their stabilization grants. These are grants that go out to providers, child care providers of all types, in order to help them recover and become whole after this really difficult year with the pandemic. The states that are up and running are Connecticut, Delaware, Illinois, Kansas, Minnesota, New Hampshire, and Oklahoma. And we know many more are working on getting theirs rolled out soon. The Office of Child Care is tracking and posting links on our COVID-19 technical assistance site. I believe Melissa is going to put that into the chat for you. So that is one way you can stay updated on how the stabilization grants are rolling out in the states and take a look at what those applications look like. Second, I just wanted you to know that you can move to the next slide. Okay, we're going to be releasing more information on federal reporting requirements in the Federal Register soon. We know there have been a lot of questions. Folks are looking for more clarity on what is going to be expected in terms of reporting. We will be publishing those in the Federal Register. There will be an opportunity for public comment, but I want to let you know that these will track very closely to what we have presented in the ARP Stabilization Guidance. So there will not be surprises there. And finally, I wanted to wrap up by touching on some of the questions that we have been hearing about the ARPA funds. We will, as many of you know, we posted questions and answers on our technical assistance website over the past year during COVID. We are planning to add to those, specifically and related to stabilization and supplemental grants. So those should be coming soon, coming in batches. But in the meantime, I wanted to address a few of the questions that we've been hearing over and over again. The first is we've been hearing about how Head Start and Early Head Start may or may not be eligible for the stabilization grants. I want to make clear that lead agencies may include Head Start and Early Head Start as long as certain requirements are met. So if Head Start programs are included in the state licensing system, they may meet the eligibility criteria that we included in the ARP Act. In cases where they do, lead agencies still get to decide which providers they're going to include in their subgrants. And because other ARP funding is explicitly being directed to Head Start programs nationwide, and because they continued to receive federal grants during the pandemic, we have recommended that lead agencies only include Head Start and Early Head Start programs for stabilization subgrants under limited circumstances. But one of those circumstances is something that our local partners are involved in quite a bit, and that is such as when a Head Start program grades or layers CCDF and other child care funds with Head Start or the Head Start program. In instances like this, or in areas where Head Start or Early Head Start is the only early care and education program in a community, it may be very appropriate for the lead agency to be including those Head Start and Early Head Start programs in their ARP stabilization grants. The second question I want to touch on is the issue around posting subgrant applications. So the law does require each lead agency to post on the lead agency's child care website their stabilization subgrant application. What we have been finding just in these early months is a lot of states are working very hard to reduce the burden on providers applying for these grants, which is great. We absolutely want to make this as easy as possible for providers to apply for these funds. But in doing so, they've been using systems where information is pre-populated based on what they already have in their system. That, of course, is completely fine, but it is still important that the applications be posted on the child care website. So if it is easier, this could include posting a PDF copy or screenshots of the application and making sure there's a link with an email for child care providers who may not have been reached yet by the state. Third, I wanted to just remind everyone that to meet the needs of the entire child care market, lead agencies should include a broad array of providers in their stabilization grants, not just the usual suspects. While the law provides certain parameters around who is eligible, lead agencies have quite a bit of flexibility to decide which providers to include in their subgrants. Certain practices like sending applications only to providers who receive stabilization subgrants in the past may limit the reach of the ARP stabilization funds. And for that reason, we are strongly encouraging lead agencies to do outreach to providers and communities who may not have participated in the subgrants before, but are eligible under ARP rules. And then one final thing, there have been some questions coming in about whether or not lead agencies can reprogram other more flexible CCDF or relief funds like CARES and CRSA that were previously designated for stabilization grants. So some states had planned on using the CRSA funds for stabilization type grants, but now may want to repurpose that funding since the ARP provided funding explicitly for stabilization grants. CCDF lead agencies are able to reprogram regular CCDF, CARES, or CRSA funds until the obligation deadlines, which is September 30th, 2022 for CARES and CRSA. Obligation and liquidation information for regular CCDF funds is described in instructions to CCDF expenditure reports, and reprogramming funds for other allowable activities does not constitute a cut in funding for childcare for eligible individuals and thus is not considered supplantation. So there have been some concerns about what reprogramming meant for the supplantation provisions in the ARP, so we wanted to provide clarity on that. Additional information will be on our website soon on these matters, as well as other questions that we are hearing. And that is it from the Office of Child Care. So I'm going to turn things over to my colleague, Dr. Futrell with the Office of Head Start.
Thank you so much, Dr. Friedman. Good afternoon and hello, everyone. I am Dr. Futrell, the proud director of the Office of Head Start. And want to say thank you all for attending and engaging and being a part of these webinars, as it is our goal to come together as a united early childhood and education community. I'm here to share some ARP implementation highlights from the Office of Head Start. And to get right started, happy to share that the $1 billion that was awarded to Head Start is making its way to many Head Start programs, with over 90% of those funds now being with programs and having been awarded. What we've been doing to promote these funds is to really engage in intentional conversations around what it means to get back to in-person services. You've heard me share before that over a third of Head Start programs are operating operating in person only, and also a third fewer children have been served before the pandemic. So we really, really, really want to do everything we can to build back towards our full enrollment and full open in-person status for programs. And we recognize that this is something that we have to do in partnership, we have to do together. And so to do this work, we are doing our Head Start Forward campaign to have conversations around sharing effective practices and addressing topics that we want to provide support for the Head Start community when it comes to building back to in-person services. We call it a ramping up. So we're looking at ramping up towards that January date when we will begin to monitor programs again with regards to enrollment. A part of the Head Start Forward campaign is some site visits, and you'll see some photos on the screen as I share a little bit about the work that we're doing. But what I am proud to share is with the ARP funding, what we know right now is more than a third of Head Start programs are using or plan to use the funds for some summer programming, some summer full programs or some summer activities. And we find that very promising, and we encourage others to consider to do that with the goal of building back to what it looks like to be in person in the fall. Others are using the ARP funding for kind of health equity, talking about the vaccine access, as well as making available health clinics and the like within programs. And we're also learning and appreciative that many programs are also using the funds to support the workforce and to support our Head Start community with support when it comes to quality and mental health and awareness for our staff. As I mentioned, we are on a Head Start Forward campaign. We kicked it off with a visit with the Secretary of HHS to Martha's Table in DC, We had a beautiful time there, and Muriel Lopez Humes, who's the Deputy Chief Program Officer at Martha's Table, who is a new friend of mine as well, will share some of the great things that they're doing with the ARP funding here shortly. But what I do want to share a little bit, in addition to going to Martha's Table, I also had the privilege and honor to go visit my own Head Start program in Southern Virginia, the program that I was in as a 4-year-old. And also had a great opportunity just yesterday to visit with the team at Philadelphia Public Schools there in Pennsylvania, as well as Children's Village in Pennsylvania. Those photos are now on the screen from that visit. And what I will share with you is what I'm learning in addition to the data that we know about what the plans are for the ARP funding. Programs are also using the ARP funding to do a few things. So a few of the observations. So the first, in addition to what I mentioned about preparing for the fall, vaccine, health equity, is making equity an action word. And Dr. Friedman talked about braided funding and looking at different ways to ensure an inclusive, unified experience for children and families within Head Start programs. And we also want to encourage prioritizing topics around equity within professional learning for your staff, and want to just lift up on our own OHS website that we have pulled together some resources around equity that we would encourage you to take a look at and identify if there are any areas there that you want to lift up. The other one is the idea that family partnerships are key, and this is the Philadelphia team with the superintendent there. And what's been key is programs are also using the funds to reach out and connect with families, and also thinking beyond the ARP funding, as Katie mentioned, in terms of investing and partnering with families. OHS has kicked off an initiative investing with families, and where we're kind of coming together once a month to share resources and information around how to connect families with local benefits, explaining what the child allowances are when it comes to tax credits and the like. And you can find all of this information on our website around our family partnerships. We do have a webinar coming up on August 26th from 3 to 3:30 for that. In addition to our partnering with families and family partnerships, we also know that our programs are really focused on finding, enrolling, and supporting and partnering with more children and families, not only just to meet the enrollment goal, but also to really respond to what has happened to us and what has happened in our communities. And so we know there are new families and new communities that will benefit and be partnered with Head Start that were not before. And so we want to be intentional about getting back to in-person services, but also reaching and supporting in partnership with children and families. And again, we're doing that through our Head Start Forward campaign that is continuing to grow. And we're excited about that. Again, the site visit yesterday as reading Pete the Cat, that was fun. But also tomorrow we have a webinar where we're going to really talk about mental health and staff wellness, because the first step, I truly believe in getting back to in-person services and getting all the things that we've set out as goals is really to start with our staff and our workforce, and to kind of do the check-in and then ensure that we can do our part. I know there's some things that are out of our control, but we can try to do our part when it comes to mental health and staff wellness. So we're going to have a webinar tomorrow at 1 p.m. on that. Again, you can follow along on all of the OHS webinars for Head Start Forward, the Investing with Family resources and outreach that we're doing on our website. And I believe the links will be posted in the chat. I do want to also lift up, I know we had quite a few questions that have come in that we've been able to respond to through our Head Start Forward webinars. And the webinar tomorrow, again, on mental health and staff wellness, you can register there. And before that, we did a webinar on enrollment. And prior to that, we did one around program structure. And so what I do want to make clear is the structure of those webinars is we do a high-level overview of our expectations on that topic. And then we go to a very clear Q&A where the Office of Head Start staff is answering some questions that have come in specifically as it relates to what does it mean when we say ramping up to in-person services. So I would encourage you to attend those or to go on the website to follow the links to be a part of that. Now, with that, a core commitment or value of mine is really, and has always been, to highlight and share effective family and child-centered practices And as we aligned again to do more together than we can do on our own, I am always honored to share and highlight great stories, and with gratitude and just, you know, a great appreciation for the leadership of Martha's Table and what they mean and what they do in their communities. I'm very pleased to now introduce you to Muriel Lopez Humes, who is the Deputy Chief Program Officer at Martha's Table. She's going to share a little bit around how they are using the ARP funds and why it and what they're using it for, and the importance of getting back to in-person services. Thank you. Welcome.
Thank you. Thank you so much for having us. It's good to see you again via video, Dr. Futrell. It was a couple of weeks ago that we had the visit. Thank you, everyone. We are so thrilled to be part of the Head Start family at Martha's Table. A little bit about us that will help you understand, you know, how we approach education and definitely how we're using the funds. For those of you that don't know, Martha's Table is a nonprofit organization. We're located in DC, Washington, DC. And we really approach our education program and all of our programs with the belief that we believe in strong children, strong family, and strong community. We truly believe that every Washingtonian deserves the opportunity to thrive, and we do that through our programs. So as I mentioned, we have an early learning program at our headquarters in Southeast, where the visit was, that we support children 6 weeks to 4 years old. We also have another center in Northwest where we support children 6 weeks to about 3 years old. And part of our programming is supporting the whole family. So a piece of that is also, we have a health and wellness programming where we have no cost groceries that families enrolled in our program, and of course families in our community can access as well. So there are lobby markets where folks can come in and shop for no cost groceries. We also have a family engagement whole team that really works with our families. They do home visiting. We have home visitors. We provide families with parenting classes, diapers, wipes, all of those things. It's really important for us to take that whole family approach as well. And we also ensure that our parents have access to, you know, all of those things. So one of the things that we are utilizing the funds for, the American Rescue Plan funds for, is our summer programming, as Dr. Fertel had mentioned. For us, we're a year-round program, but our summer program runs about 7 weeks. And what it really allowed us to do is to really enhance our summer programming. So like all of you, we had shifted to virtual learning, but we were excited to shift back on March 15th. So we've had our children back, all of them back as of April 24th. And we have really been able to engage in more activities that are hands-on. We've been able to purchase supplies that we weren't able to before. For the summer, we're thrilled to do water play and have more water tables and buy aquariums for the children to actually engage with. We're looking forward to taking them on field trips and taking them, of course, COVID safe, but taking them to the aquarium. The funds have really helped us be able to do that. And even earlier on in the year, receiving the CARES Act funds allowed us to do the same, purchase supplies for families to have at home so they can have engaging activities with the kids. So we've just truly been grateful, and it's really helping us ensure our program is strong and focusing on that return on site. I know we talked a lot about the in-person and how important that is. And I think I'm sure all of you have seen for children transitioning back on, it's really important that they have that socialization and that they're engaging one-on-one and that they're having those activities. So this has allowed us to do that and continue to do it throughout the summer.
Thank you so much. And thank you for your leadership in the community. We really appreciate it. And it was wonderful to go visit. We were able to see in action the great work that you all are doing, not only with our Head Start babies, but with families as well as the whole community. Thank you so much.
Thank you.
Thank you. And with that, we happy to turn it back over to you, Katie. Thank you.
Thank you so much, Dr. Futrell. Thank you, Muriel. It's wonderful to hear about all of the exciting things going on in Head Start programs across the country, and glad that leaders have been able to engage with children and families who are benefiting from the American Rescue Plan. I'm going to ask that we put the slides back up. Great. Thank you so much. So I am joined now by my colleague, Miriam Calderon from the Department of Education. We have been working really closely together to think about what are the next steps that we want to see for children and families in this country, especially when it comes to early childhood development. As you all have heard, the American Rescue Plan is making critical steps for families, for Head Start programs, for childcare providers across the country. But we know that that's just the first step. That was the kind of the Band-Aid on the problem to make sure that families, childcare providers, Head Start programs are able to see it through the pandemic. They don't have to close their doors. They're able to provide the programming that is needed. But we know that we need a long-term solution. Before the pandemic hit, we know that childcare providers and Head Start staff were paid wages that were far too low. We know that a lot of families didn't have access to Head Start or have access to childcare assistance because the funding simply wasn't there to provide it to all families that need it. And we know that many families struggle to find an affordable, high quality childcare program that met their needs, that was available in their neighborhood or near work during the operating hours that they needed. So what the president has outlined in response to building what we're calling building back better. So not just trying to get to where we were before the pandemic hit, but thinking about what supports, what policies, what programs do we want to have in place for children and families to make sure that for the long haul, we're investing in families, we're investing in young children, and we're really creating the system that we know families need to be successful. So the president has really linked the American Rescue Plan, the American Jobs Plan, and the American Families Plan. So it's about infrastructure, it's about job creation, it's about recovering from the health and economic crises, but also making sure we're working towards a better system for families. So Miriam and I are going to share a little bit more about what is in the president's American Families Plan in the Build Back Better agenda, in hopes that we can kind of share what that long-term vision looks like and what comes next after the American Rescue Plan. So the president has proposed $450 billion in new early childhood funding. And that is huge. It is the largest proposal we've ever seen in terms of early childhood. It's a 10-year investment. So it's really looking at how do we build towards the system that we need. It includes $225 billion for childcare for American families, which I'll describe in a little bit more depth, but essentially would make childcare assistance much more widely available. $200 billion for universal preschool. This is free preschool for all 3 and 4-year-olds, and universally available to all those who want it. And then $25 billion for childcare infrastructure. So we know that there are childcare deserts across the country. We know that there are buildings that are in need of repair. So this funding would allow us to build that childcare infrastructure and also invest in supply building, because we know there are many areas of the country where there's a need for childcare supply. Across all of these proposals, I want to talk through some of the really key pillars in the early childhood programs. So first is mixed delivery. Whether it's in childcare for American families or universal preschool, we are talking about a mixed delivery system that builds on the infrastructure we have now. So that means Head Start programs are providing childcare and preschool. That means family childcare is included in preschool and in childcare. That means childcare centers are part of this. This means we have schools and LEAs providing preschool, but the parent is really choosing the setting, and we have a robust set of options across all types of settings, and we know that quality can occur in all types of settings. The second piece is wages. What the president has proposed is that regardless of setting, early childhood educators are making at least $15 per hour. And if early educators have the same qualifications as elementary school teachers, they are making the same amount of money. And the last piece is quality. Quality and wages are closely intertwined. We can't have high quality programs if we don't have wages across Head Start, across schools, across childcare settings. But we also know we need to build inclusive settings. We need to have appropriate curriculum, low wage ratios. We want to make sure that we are supporting building towards a high quality system across the board. Next slide. So I want to talk a little bit more about childcare for American families. This program, as I said, would significantly increase the number of families receiving childcare assistance. Everyone would be eligible if they're earning less than 1.5 times the median income in their state. I know that's kind of a wonky term. It really varies across the state. The income threshold is higher in more expensive states and lower in less expensive states. Across the board, it's about $100,000 for a family of 4 if you're trying to kind of give a national picture. And it means that all of those families who wanted it would get it. We wouldn't have the waiting list like we do now with CCDBG. Families would pay on a sliding scale such that no family paid more than 7% of their income for childcare, regardless of how many children they have. And the lowest income families would receive free childcare. So it would be a sliding scale where people pay slightly more as their income gets higher. Very importantly, this would be inclusive for children with disabilities. We want programs that work for all children and that are affirmatively inclusive of children with disabilities and make sure that they have the supports that they need. Provider payments are based on the cost of quality. So this is a really important point, and it's very different from how we pay for childcare right now, which is based on a market rate survey, which means that it just reflects what already exists in the childcare market. So if wages are low in the childcare market, if quality is difficult to find, if there's if payments are low because that's what families can afford to pay, all of that gets reflected back in the market rate survey. It's just based on the prices that childcare providers are charging right now. We want to move towards paying on the cost of quality, which means we look at what wages need to be. We look at how much some of those components of quality cost. We look at how much it costs to serve children in a high quality setting, and payments are based on that level. So that's what the Childcare for American Families plan proposes working towards. And as I said, increasing wages is kind of where quality starts and ends. So the cost of quality needs to include the increase in wages. So we will go to the next slide, and I'm going to turn it over to Miriam to talk more about universal preschool and some other components of the American Families Plan. Miriam, welcome.
Unmute there. Thank you so much, Katie. Good afternoon, everyone. I'm Miriam Calderon. I'm the Deputy Assistant Secretary for Early Learning at the Department of Education. I'm thrilled to be able to join Katie and talk about components of the exciting American Families Plan. So I'm going to start and talk about universal preschool, which is designed in this proposal to build back better to really complement the childcare proposal that Katie was just talking about. So the universal preschool investments are envisioned as a funding partnership with states, meaning that would be created in a way where there would be cost sharing with the federal government and states to achieve universally accessible or available free preschool education opportunities for all 3 and 4-year-olds. This would I think complement the childcare proposal. As we know, one, childcare serves children older and younger, and is broader than inclusive of children ages 3 to 5 and that are preschool age. But we know often much of preschool education and Head Start isn't typically aligned to the working day and full year needs of families and childcare. So that is also very complementary, we think, and is accounted for in this proposal. It is taking into account some of the evidence about the importance of 2 years of preschool education and some of the benefits, and is focused on prioritizing children and families in high need areas first. So we know that not even with this incredible investment of $200 billion that Katie talked about, it will take time to scale high quality preschool education programs for all 3-year-olds and 4-year-olds in communities across our country. And so this proposal is taking that into account and would focus on, again, ensuring access to high need communities and children and families who have been historically underrepresented in preschool education programs first, as the program grows to serve more children and families that could benefit from the program. Katie talked a lot about quality, and some of the aspects of quality that were in the childcare proposal are also mirrored here in the universal preschool proposal. So again, emphasis on developmentally appropriate curricula, low adult-child ratios, group sizes, inclusion of children with disabilities, investments in educators, and both in terms of compensation and also coaching and professional development are things that you hear the president and the administration talking a lot about as very important as we think about really aligning and making the kinds of investments in preschool education that we know are really grounded in the research about the kinds of programs that produce some of the lasting benefits that we know are possible with high quality early education for young children, both in their academic careers and school careers, and also impacts throughout their life. And we know that we've seen, in particular in Head Start and other high quality state-run preschool education programs. And then we know that the president also talks about, and I think would be remiss in not saying that, preschool education is something that we know is really out of reach for many families of children of color, families of color, low-income families, because the costs are similar to childcare, really expensive and often out of reach, and really zip code, race, income can be predictors of whether children have access to a high quality preschool education program. And so we know that this can also be a benefit for families. And while some families who don't have access to publicly funded programs in their communities do, and particularly moderately income families, families who don't qualify or right on the line of qualifying for some of our publicly funded programs do pay or don't have access to some of these higher quality programs. And so they are paying out of pocket. And so we are estimating as well that this will be a cost saver for families as well. And which we know will also have a huge impact and benefit for families. So very exciting to see this investment in universal preschool alongside the childcare investment. Yes, this does include opportunities for tribes to expand preschool. I saw that question come in, so I'll just go ahead and answer that really quickly. Through a tribal set aside is something that the administration is committed to. And we know that's already opportunity. There's already an opportunity that we know exists through Head Start as well as through childcare. So we can go to the next slide. I want to emphasize again something that Katie talked about in terms of the mixed delivery system. We know that most of the states that have a preschool education program are already operating their state preschool programs through a mixed delivery system that is inclusive of family childcare, Head Start schools, childcare centers. As Katie talked about, the administration is absolutely committed to a mixed delivery system as part of its universal preschool program. And so we know that we will be building on a lot of the infrastructure that states already have with respect to their state preschool programs, as this will be done in a funding partnership with states. And that is the proposal if this is to become a reality, we hope. And so I think that really this is an exciting opportunity to think about how we, through this opportunity, think about how we start to build the kind of infrastructure and capacity in states and in communities to be able to support strong mixed delivery systems. We know quality can happen in a variety of settings. We know that a variety of settings are needed to be able to meet the different needs and preferences of families, but it is really going to take infrastructure and capacity to be able to ensure that quality can be built. Different sectors and parts of the mixed delivery system have different needs. And I think that is really the work ahead for us if we have the opportunity to be able to implement this, is to build that kind of infrastructure and capacity in states and communities to really be able to build strong mixed delivery systems. And so I wanted to say that that is absolutely part of the vision here, both thinking about the childcare and preschool together, and building strong mixed delivery systems in states. I'm going to go ahead and talk a little bit next about just briefly about some of the higher ed proposals as well, because I think they're really, we know, exciting and important for our families, as well as I think they open up. I'm very excited to think about, and I know Katie is as well, what opportunities these might present for our workforce as we think about how that might complement what we know are going to be really exciting opportunities, hopefully to scale more childcare, high quality childcare and preschool opportunities for children in communities. So part of the American Families Plan, and you often hear the president talk about an additional 4 years of education or building on the education system. So he talks about 2 years of preschool for 3 and 4-year-olds. And then he talks about 2 years of free community college. So the president has proposed $109 billion investment in free community college. He has also talked about increasing access to 4-year institutions, and really tackling the college affordability problem. And that is increasing investments in an additional $85 billion in Pell Grants, including increasing the value of Pell Grants. So they are, more, have more power in the market, I think, for students, and can help cover more costs. I also am super thrilled that the president is talking about making and proposing to make Dreamers eligible for Pell Grants. So that is part of the proposal as well. So he is also making and proposing significant investments in minority serving institutions, really building on the successes of historically Black colleges and universities, Hispanic serving institutions, tribal colleges and universities, and other minority serving institutions, and being able to provide institutional support for those organizations, helping them build more scholarships and open up more access, given their really track record of success in being able to graduate diverse individuals and people of color, and with college degrees and 4-year degrees, 2 and 4-year degrees. He's also proposed a $62 billion investment in college retention and completion rates, again, targeted at students who are representing or come from historically underserved communities. And then he has called for over close to $10 billion, I think around $9 to $10 billion in new investments in diversifying the educator workforce. So from investments of specifically targeted towards scholarships for diverse individuals to go back and get their degrees, to helping diverse individuals get credentials in high demand areas like special education or bilingual education. He's called for more diverse individuals to be able to grow into teacher leadership positions, more investments in grow your own programs. We are very excited about these proposals can open up more opportunities to for early educators as well, and thinking about our workforce and the diversity that already exists in our workforce, and in creating more pathways to 2 and 4-year degrees for our workforce as part of these proposals, including expanding access to minority serving institutions for our workforce. So we think a lot of very exciting stuff and opportunities that lie ahead in these post-secondary proposals as part of the American Families Plan as well, that we are excited to continue to explore as this plan moves forward. So I think that was my last slide, and I'm gonna go ahead and kick it back over to Katie. Thanks, Katie.
Thank you so much, Miriam. We appreciate all of the questions in the chat. I tried to answer those that I could. But to just give a little bit more background on where this stands, this is a proposal that the president has put out there. It now goes to Congress to negotiate a lot of the different components. And we don't know precisely what the timing is, but we are working closely with our colleagues across the administration and on the Hill, so that we'll be ready to roll this out and make sure that benefits can get to families and children as quickly as possible. But a lot of the kind of specific details will need to be forthcoming as Congress kind of undertakes this process. I know we are a little bit over time, but I wanted to just share a little bit more about the benefits for families. There is a provision in the proposal around the Child Independent Care Tax Credit that would expand the tax credit such that families could get a maximum of $4,000 for one child and $8,000 for two or more children. And that tax credit would also be refundable and available to families that don't owe taxes. And that would kind of sit with the other early childhood proposals if families chose to take up that option. It would also extend the child tax credit that families are getting now that we talked about at the beginning of our time together, and make that available for the next many years, not just this year. So that additional amount of money, so it's $3,600 for a child under 6, $3,000 for a child 6 to 17, that would be available over the long term. There's a provision for paid family and medical leave that would provide wage replacement for time off to care for a new child, to care for a loved one, or to take time off when an individual is ill. There's also an expansion of nutrition programs, school meals, summer EBT to make those benefits available to all eligible children. And some additional funding for health insurance tax credits to make some of those ACA plans more affordable for families. So there's a lot in here, not only on the early childhood front, but the higher education front, overall benefits to children and families. And that's why we're really excited about it and grateful to be able to work on it. We will continue to keep you posted on progress towards this plan. I think this summer will kind of be telling in terms of what Congress is going to do and how they decide to move forward. But we wanted to make sure you were aware of what was in the plan and look forward to continuing to answer your questions. I also put a link to the American Families Plan fact sheet in the chat. If you click on that link, you can go to the White House webpage that has all the information on what the president has said about this plan and the different components. So I know we are over time. I want to thank you for joining us today. I'm going to ask that everyone take some time to go to childtaxcredit.gov, learn more about what's available. You all play such an important role for children and families in your communities. You are so critical to us getting the word out about this. We want to make sure families have the financial resources that they need, that they are entitled to. We're putting the link to the IRS tool again in the chat. Any family that did not file taxes, maybe especially low income families, they can go there and they can sign up to get these benefits. And we really want to make sure that those families that need it benefit the most. So please, please, please help us get the word out. Talk to families in your programs, in your communities, your networks, and make sure to help us get the word out. With that, I again want to thank you for your time. It's been great to talk to all of you today, and we look forward to talking next month. Have a great day.